Okay, so now we're going to discuss strokes. So what happens when a stroke happens is there's either a vessel in the brain that bursts, that causes a bleed, or a piece of a clot somewhere in your body dislodges and goes to your brain and occludes a vessel that's transporting blood to your brain and blocks it. And then that area of the brain starts to die. That is the most common one, is the clot, not the bleed. Usually signs and symptoms of a stroke, there'll be headache, there could be blurry vision. There's one mnemonic that you can follow, it's called FAST, and the F stands for face because there'll be a facial droop, one side will droop down. And then you'll ask them to hold their arms out like this, and you'll ask them to close their eyes, and you, in your head, count to about 10. And say the droop is on the left side, then the right arm will start to drift a little bit. S on the FAST mnemonic is speech. You would ask them to speak to you and say a sentence or repeat a sentence. So the sun is shining today, the sky is blue. And they won't be able to say that sentence correctly. It will sound different than they normally speak. So it could be slurred speech. They could move their mouth and nothing will come out. It'll just be different than their norm. The T in the FAST mnemonic is for time, and that's very important for the hospital to know. So they need to know when these symptoms started. So if you have your partner or whoever, you go to bed and you're both talking normally and you're both normal. In the middle of the night, your partner gets up to use the bathroom and you don't hear them. You wake up at 6 a.m. and they're on the floor, okay? You don't know what time they landed on the floor, and right now when you go over to them, they're showing those signs of a stroke. Your last time you saw them normal was when you went to bed at 11 p.m. If you heard them fall and you had gotten up to help them and you saw their symptoms and called 911, you would know that their signs and symptoms started at that point. It's 2 o'clock in the morning or whatever. It's important because the hospital needs to know when that starts so that they know if they can push a certain drug or not. So if the last time you saw them normal was at 11 p.m. and you find them at 6 a.m., that window is gone for the hospital. But if it happens in front of you, if you're sitting at a table and they drop their fork and all of a sudden they're not speaking right, and you start talking to them and you notice something's off and you call 911, at that time, that is when the symptoms start. So the hospital has a whole lot of time to push medications to break up the clot. During this time, please don't get confused with cardiac issues. You are not to give anybody showing signs and symptoms of a stroke aspirin. If they are having that bleed, it could cause them to bleed out or make the bleed worse. So definitely do not give anybody experiencing a stroke aspirin. Aspirin is only for cardiac patients.